When Congress passed the Affordable Health Care Act, says Public Health Director James Gillen, the territories were an afterthought.
The whole program for Guam and the territories was an afterthought. Okay, when they started looking at this, oh yeah, we have territories out there we have to do something with. But we're not getting the same treatment.
As an example, Gillen points out that states who opt in for the additional Medicaid benefits will receive far greater coverage than Guam or the other territories.
In a state, if you opt in to cover these people at 133% over the income level, poverty income level, Medicaid will pay 100% of the cost related to that category for 3 years. And then after 3 years, 90%. Guam has $200 and some odd million to use through 2019 if we can match it.
One way of trying to match the additional funds Medicaid is offering is moving some island residents off of the medically indigent program, which is paid for by Guam taxpayers, and into Medicaid, which the feds pay for.
We'll be moving a lot of people off of Medicaid, MIP, okay, into Medicaid, those 133%ers. We will take whatever the savings was that was being charged to MIP to use for the local match of the additional money.
As for whether or not the individual mandate requiring everyone to get insurance applies to Guam, Gillen agrees with Insurance Commissioner Artie Logan and Netcare Administrator Jerry Crisostomo, who say that the mandate does apply to Guam in the wake of the Supreme Court decision.
Whatever the judge decided is decided. Now people are going to have to interpret it.
Well, just because, I mean, if it's a tax, it applies to Guam? Would you agree with that?
I would say yes. Yeah. Because we have a mirror image tax system.
But then there's the question of the insurance exchanges, a collection of health plans offered by on- and off-island insurers, where island residents could shop for the plan that suits them best.
The Fed saw the solution that, well, we're going to make insurance so cheap through the exchange that even people with low incomes who don't otherwise qualify can purchase. The problem is there are subsidies built into these. The people with certain incomes, they're going to get a rebate on the premiums that they pay. And that's where Rev and Tax has a problem, because that's money coming out of the general fund. This is not going to be supplemented by federal money.
If Guam chooses to implement that option, Gillen says it would take action by the legislature and the governor to authorize it, and the cost would be prohibitive.
You have to have insurance legislation establishing the exchange. Okay. But I think again that Artie Logan is correct. We cannot afford it. Just the first brush, we look at what's allowable and what you can do with this exchange.
We cannot
afford it.
Simply why?
Because the money, this rebate program is going to pull money out of the general fund. There's no supplement from the feds to do that.
Kevin Kerrigan, PNC News.